everyone to today's program. I am Kathy Brett with Becker's Healthcare. The program will begin with a presentation and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have and will follow up on questions that we do not have the opportunity to address. You will receive an email within about a week following the webinar that will include instructions for how you can download a copy of the presentation. You will also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It is now my pleasure to introduce today's presenters. As you are all aware, the Patient Protection and Affordable Care Act has created a variety of new rules and regulations that are adding to the cost of human resources for surgical facilities. Tom Jacobs and John Mirsky Jr. of MedHQ have put together a presentation that will update everyone on strategies to navigate PACA and will present 5 ways to lower expenses in the wake of these changes. As a bit of background, Tom Jacobs is the president of MedHQ, a human resources and back office resource for healthcare facilities in 16 states. Tom has grown MedHQ to work with more than 50 surgery centers, hospitals, physician practices, and other physician-affiliated organizations. John Mirsky Jr. is MedHQ's Executive Director of Human Resources. With over 30 years of experience in HR, John has a record of success guiding and advising senior healthcare management on the strategic alignment of HR services with the needs of the business. John is responsible for more than 1,000 employees at client facilities. Tom and John, thank you for joining us today.
Next slide, please. Thank you, Kathy, and thanks to all the participants on the call. And thanks for joining John Mirsky and me for a discussion of the rising cost of human capital and the 5 strategies every surgery center must have in place to effectively manage these expenses. As was mentioned, MedHQ's mission includes bringing the best in HR practices to surgery centers. John and I will have a conversation with you today about the most critical HR practices for surgery centers. These are the very solutions that John and his team deliver daily to surgery centers across the country. We know that labor is the biggest line item of expense on all our financial statements, so it just makes sense that if we can reduce labor cost by a relatively modest amount as a percentage of total expense or as a percentage of total net revenue, then we can make a significant improvement in the bottom line of our surgery centers. But there is potentially more to gain than just cost savings. We believe HR practices can truly transform a business from being good to being great. For example, the Fortune 100 Best Places to Work is full of great companies that exemplify these HR practices. And for those of us who like to have more of a bottom line representation, consider that the Fortune Best 100 Places to Work outperform the rest of the S&P 500 by a factor of 3 to 1. Next slide, please. To know that if we have an opportunity to trim labor expense and potentially add 5% more of my net revenue to the bottom line, that's huge. We would all be happy with an additional $250,000 of profitability. But in recognizing this opportunity, it's crucial to remember that it is indeed people that are front and center in this conversation. We'll help with all their fears, their optimism, their ideas, their wants, their needs. That's why it's our mission at the outset, or included in our mission at the outset, we must approach this opportunity using best practices. At MedHQ, we're passionate about this mission. We truly love what we do. We love becoming intimately involved with the success of our clients in implementing these practices. Next slide, please. We're going to walk through 5 strategies that will enable these improvements in labor productivity. But first, we need to discuss the one significant headwind we're all facing, the Affordable Care Act, which we're sort of beginning to feel like it's a death by 1,000 cuts.
Well, when we look at this entire list that's in front of you at the moment, there are a number of them we could touch, and we could take an awful long time covering each and every one of these. But I want to just bring to your attention things such as the limitation on the flexible spending accounts. That has changed now to $2,500 a year, and that is a radical change for your employees. If you're not aware of it, your brokers and or your HR services provisions right now should be making those adjustments. The dependent coverage up to age 26 has been enacted, and for all practical purposes, that's not going to disappear probably anytime soon, if ever. With regard to the medical loss ratio, if you are not familiar with the medical loss ratio, you should become very familiar, because it is essential to how much things are going to cost for you, how much money could be coming back to you, if you're over 50 lives, under 50 lives, self-insured, partially self-insured, whatever. But the point being, things of these natures are driving up the cost of insurance, and these are just some of the ones that are starting to come out of the woodwork, and they're being distributed in little forms, memos, and that throughout the last couple of years, and they will accelerate in the next few months.
Next slide, please. One of the big impacts is, let's just take a quick look at taxes and fees.
There are going to be a lot of taxes and fees. If you haven't seen them already, you've noticed that there has been a payroll increase, a tax that's going to Medicare. Now, the point being, you're not going to get away from them. Some of the people that are listening this afternoon believe by going to the exchanges, that by its very nature is going to relieve them of other things. Well, there are fees, taxes, and other incurred dollar amounts that are going to be placed upon each and every one of you, regardless of which direction you go. So getting away from fees and taxes is virtually impossible as things start rolling out over the next several months.
Yes, we've seen the pharmaceutical manufacturer's fee, medical device manufacturer's fee being debated recently. But things that get rolled right into the health insurance, there's an insurer's fee, there's a transitional reinsurance fee, risk adjustment fee, and this PCORI fee are all fees that roll right into the cost and add to the cost of health insurance for everybody. And then on top of that are the fines that if you're an employer over 50 employees, 50 full-time employees, which we'll get into in a little bit, those would also come into play. Next slide, please.
As things begin rolling out, the whole idea of the exchanges is coming and becoming paramount. Some states, as you can see in the blue color, are declared as state-based exchanges. You know these are coming. Some have decided to have the federal exchange be in their particular states, and then there's a crossbreed, an interchange between the two, which, as you can see, Iowa, Illinois, Arkansas, states of those nature in the lighter blue are showing. Now, the flexible spending account limits does come into play. That $2,500 is certainly going to make things different for everyone. This is probably not going to change. This map that you see right now is probably the way it's going to be up until it goes into 2014. There may be some odd changes from here on out, but it looks as though most of the states have made their commitments one way or the other right now.
So just as a point of advice, whichever state you're located in, it's a good idea to become familiar with which of these three choices, so to speak, your state has made with respect to participation in the health insurance exchange, because that may impact how you interact with health insurance down the road. Next slide, please. So it's coming in 2014, January 1st, 2014. There are a number of things that actually, that's where the rubber hits the road.
You're going to see the individual mandates. There are people who are going to try to decide which way they're going to go. Are they going to stay with their company's insurance, go the individual situations? Are we going to have affordable plans, and do they meet the qualifications? All these things are going to begin happening in 2014. The one at the bottom, the removal of pre-existing medical conditions, in essence has already been enforced, and it's not going to go away. This is a very large portion of the cost that's been increasing the healthcare costs. Just as recent as this morning's news, it's been declared by both the government and news alike that the cost for the insurance is beginning to be looked at as anywhere from 100 to 200% increase in the cost on the individual plans. This is a very, very significant change in the cost to your facilities, something we need to keep a very sharp eye out on.
Next slide, please. So we hear some folks talking about, well, there's so many things happening, and we hear things like Representative Ryan including total repeal of the bill in the congressional budget proposal. So some are saying, well, don't we just want to wait and see? Maybe just it'll all go away. Well, obviously we can't do that. In a bill this large, there are actually a few things that I think most people will like. Surely there are many things many of us don't like, but many of these things are, regardless, are going to be, are in place right now, are coming this year, or January 1st is a big date where they will be in place, so we do need to pay attention.
Everybody that's on this webinar right now is in search of the answers as to what is going to go on with the Affordable Health Care Act. Unfortunately, it's not as clear as it can be and should be. Just recently, in the month of March, there was supposed to be an announcement sent out to all employees to go over that map, to go over the exchanges, to go over what is going to happen. The announcement that was provided to all companies throughout the United States was then, just days before its announcement, was asked to be turned back to the government because the clarity of the memo, the announcement itself, was taken back and now not going to be distributed until sometime in September or October. Unfortunately, everybody that's listening is going to have to deal with the last quarter of 2013, and many of your questions may not even be answered until September or October, because the government, in the example of the newsletter that was supposed to be sent out, has to be rewritten because changes have already occurred. So we can't wait for Washington. We know there are certain things that need to be done, and you just need to move forward. We'd like to share some of those as we move on this afternoon.
And just one other bit of news that maybe many of you heard. Just last week it was announced that the SHOP Exchange, which is the Small Business Health Options Program, that's supposed to offer employees of small businesses, those of 50 employees or less, the opportunity to go to these exchanges and choose between a number of different health plans, meaning different carriers, different plans, different products. Unfortunately, what was announced last week is everybody's only going to have one option that they can select from. So even some of the things that are very crucial to the program and very popular on one side of the aisle or another, they're having trouble implementing. So it's critical we all stay on top of all these things. Next slide, please.
When we're going to take a look at the things that are going to happen to us, actually concrete things are taking place. For those of you, each and every one has a payroll system. Each and every one of you, beginning in 2014, have to have the W-2 reporting and the benefits coverage and the notice of the state exchanges. You're going to have a solid understanding of the medical loss ratio. An example might be as simple as, if the government has allowed the insurance companies to keep 20% of profit, that means 80% is what the maximum amount they can charge. Well, if your loss ratio is only 50% in these groups over 50, there's a 30% that needs to be returned back to the employer and the employees and has to be distributed by month of all those that were active in the plan. This is an extremely complicated formula, and it is only becoming paramount today. If you are not aware of this, you should be right now contacting your broker, taking a very good note of this, because not understanding your medical loss ratio could result in fines. So there are people now working on this day in, day out. There are accounting companies. Our own firm is working on this right now. You need to be aware of this. You need to be looking at retroactive coverage terminations and how the pay or play system comes into force for you. What we mean by that is, do you decide to put all your people in the exchanges and take the penalty or go on? You need to understand all those fees that are associated with that, and that's beginning to be unfolded. And again, we're sharing some with you, but those have changed even as we've talked in the last couple of months. Understanding a full-time from a full-time equivalent. Right now, it's 30 hours. If a person works 30 hours or more, they are the people that are considered full-time. Full-time is over 30 hours or more. And then you need to decide, and many companies are doing it right now. Again, that's being announced. They're actually doing a scheduling change to put people below the 30-hour limit so that they are not calculated in the formula. These are things that are going to be watched for to see whether or not companies are playing the game. You just need to be aware, what is a full-time and full-time equivalent, and that 30 hours is, without exception, the kickoff number.
So later in the presentation, we're also going to, one of the 5 strategies has to do with technology and the systems you can use to help you with these complex calculations, such as full-time equivalent. It includes either a 3-month or a 12-month look-back period and all sorts of other complications. I think there are 18 pages of regulation just talking about how the FTEs are calculated. Next slide, please. So kind of going from the HR, or from the Affordable Care Act and how that dovetails into the 5 strategies that we really want to get into, that's the next phase of our presentation here. We believe these 5 strategies together result in a more acceptable employee turnover rate, improved staff productivity, reduced direct costs of things like unemployment insurance and workers' comp insurance, elimination of wage and hour leakages, and a reduced risk in work environment turmoil, which also enables reduced cost. So let's walk through how this works and the potential savings that can be realized. Next slide, please.
Let's start off with the benefits. And again, you've heard us talk about the loss ratio. That is going to be very, very important. If you're not aware of what your losses are, sometimes people say, well, why did I get an increase of 20, 30, 40, 50%? Well, the loss ratio, if you're not familiar with it, is the single most important number to you, because it determines what the insurance companies are going to try or attempt to get from you. If the loss ratio is in excess of 100%, meaning for every dollar they've collected from you, they pay out, guaranteed that the insurance company is going to give you a significant increase in premium the upcoming year. Now, quite the contrary, if your loss ratio is low, then obviously there is a better chance that you could get a lower increase. To my experience, we have yet to see somebody get 0 or go backwards. The insurance company is not good at doing that. The other thing that people have a tendency to try to do, and that is jump from one insurance carrier to another each and every year. That will become problematic for you. 1, you don't establish a history. 2, there is a nuisance kind of a factor to the insurance companies constantly having to go out to bid. Eventually, you may have some difficulties even in securing anything of any value to you. If there's any area that you want to put any of your time and effort into, is encouraging healthy lifestyles. That would be reinforcing lifestyles that you know through disease management plans and things of that nature that will reduce cost. We have issues with regards to smoking cessation and obesity and things of that nature. As long as we're looking at the control of diabetes and those things, remember, reducing your costs with regards to claims is a direct relationship to that loss ratio. In compensation, the most important question we're asked day in, day out, all year long is the fair market value. Almost everybody you speak with, everybody that's on this particular webinar, is a competitor in the sense that they want your employees as much as you want theirs. You want their A players. But if you're only paying 50% of the market, with regards to compensation and benefits, odds are your turnover rate is high. Turnover is one of the biggest enemies of continuity in an organization. If you are not or have not considered doing a compensation and benefits analysis, it's our opinion that you are missing the mark, because you may have, that may be one of the major ingredients as to why your organization has a higher turnover rate than others. There are certainly other aspects of this, but definitely not paying a competitive wage is one of them. We know you get survey results from others, but we need to combine both benefits as well as compensation to understand the full package. Creative scheduling. We know that being flexible with schedules is a very important aspect of everything. So it's our opinion you need to continue to maintain that. Pay for performance. Again, when you do your compensation analysis, you'll take a look at any kind of a bonus situation, pay for performance, how you distribute the wealth to your employees, to your A players, versus not rewarding those who are not as good as your A players. Then employee contributions. Are they too high or are they not high enough? This is part of that benefits and compensation analysis. All these things coupled together, you can't afford to be off 20, 30% in your salaries and benefits.
And this is one of the primary areas, of course, where we see opportunity for cost savings. But the real message, what we're trying to express, is going about a rigorous analysis to make sure you have a good compensation strategy in place is critical. Some other aspects of benefits that John alluded to also, one of the maybe more positive things in the healthcare reform law is it does, in terms of a wellness strategy for your benefits plan, the new law does allow for more variation in premium and cost to the employee based on their own healthy lifestyle or unhealthy lifestyle. So they're giving us more teeth, so to speak, in terms of putting in place some things that can motivate employees to live a more healthy lifestyle, which in the long run will help our health insurance cost part of the equation. Next slide, please.
Here we go again. The productivity side of the equation, keeping your A players. The most expensive part of operating your business is the loss of your talent and your employees for any length of time. It is fairly understood for every $10,000 of salary that when you lose an employee, when they finally come to your door and they say they've decided to move on for whatever the reason, from that point till the time the replacement comes back into the chair again and is now being a productive citizen of your firm, your surgery center, your hospital, your organization, it is about 1 week and a day for every $10,000 worth of salary. So a $30,000 employee is anywhere from 3 to 5 weeks before you actually recover from the loss of that employee. And again, when you do lose that employee, you're losing the first generation of that information. Now the second person that comes in is going to have to relearn a lot of the things that was taken with the first employee that left. So sometimes it's good to have turnover, and generally speaking, it's healthy to have a certain amount of turnover. No turnover over an extended period of time has as much negative impact on a company as does an excessive amount of turnover. So turnover by itself, the word itself is not bad. It's the rate at which that is concerning. So turnover rates in 30, 40, 50% are completely unacceptable and probably costing you considerable amounts of money in recruiting fees and so on. So what we want to do is try to keep your retention rate as high as maybe 85 to 90% of your employees. Staying in that vein, you have a healthy turnover. You don't have excessive turnover. Your hiring tips should be very, very concise. You should be talking about why to come work for your company. Retention tips, the same thing. This has a lot to do with the things we spoke about earlier with your compensation and your benefits. If your compensation and benefits are not in line with the local environment, and a lot of times the people are saying to us things such as, well, we use the ASC materials for retention. Well, receptionists can work at an insurance company, a bank, or a car dealership as much as anything else. So one must know their market, not just about doctors and nurses, but your ancillary and support staff are just as important. So retention and knowing whether or not you're helping out with a single family, the employee rather, the employee's spouse, the single parent with children, or the family, they each have different requirements, and retention is going to be different for each and every group. You need to try to find out a nice, easy balance, and a good, solid HR services team working with you, with your brokers, can make that happen. Ongoing evaluations. That's not just evaluations of their performance, that's evaluations. Remember, you have patients and you have clients that come into your building, but there's a client that works within your building. They're called employees. Knowing what your employees want and do can help you retain them. So evaluating your employees through surveys is not something you should avoid. Ways to make employees happy that don't involve more money include forms of communication and award systems and such. So when you think about how do you keep your A players, try to keep these things in mind.
And just one more thing. In addition to the annual performance reviews, the salaries studies to make sure that compensation is appropriate, one of the other things we do is put together hiring guides, interview guides, I should say, for every position within an organization. The interview guide is a way to document what it is about a particular position, what are the critical attributes an employee must possess in order to be a success in that position. For we all know that a receptionist is going to have different, just different capabilities, different skill set in terms of outgoingness and things like that than a GI tech or than a nurse. They're just a different innate capability in the two different types of positions. So in our interview guides, we're asking questions that get to whether those attributes are present in that candidate or not. Next slide, please.
Next is the supervisors. We don't talk about these people enough, and these are where everything happens for all of us. If we have a good supervisory system, training, mentoring program, most of the time our risks, our liabilities with regards to a variety of things are dissipated. Failure to have a solid management team with people who are not just good technicians who've been promoted to be a supervisor. A technician does not, by its very nature, make a good supervisor. All of us seem to know that, but in actuality, when we have a loss of a manager, we first look internally, and that's okay, and we find that this particular individual is one of the best at what they do, and the natural occurrence is to take that best skill we got and turn them into a manager, and we take them out of the clinical arena and put them into this management role, and they may never have even experienced conflict between employees, and they may not be ready for such a move. Common issues related to poor or no training is just that. We're going to have issues with employees, internal confrontations that cannot be resolved, or then they kind of like play in the sandbox and don't get along. The money at risk for patient satisfaction is enormous, because if all your employees are arguing amongst themselves and they're not able to be somewhat of a Solomon and be able to know when it's a good time to be firm and when not, then people are walking around with not smiling faces or not asking the patients as they come in. Their satisfaction results may in fact affect your overall performance there. Cross-training is extraordinarily important. You should be having every person have a secondary or a tertiary person that can take over when one goes on vacation. To have a primary person and they get, by God forbid, they have an injury and can't make it to work for another 2 or 3 months, and you have not made effort to have a backup, that will become the day that you'll say, oh my gosh, I wish I had done that. There is nothing wrong with cross-training As a matter of fact, it's encouraged. At our particular organization, having things siloed was one way we changed that, and we made our client reps that are knowledgeable in multiple work areas just for that purpose, in case one has to go on vacation, an anniversary, a wedding, or what have you, then somebody can jump in and take over for them in the short duration. They may not be that good at it as the other person was, but they certainly are not going to hurt the facility or the surgery center. So cross-training is essential.
We did a survey of our clients about a year ago, and we do this routinely, but in that survey, one of the enlightening things was, of course, a lot of managers, especially if they haven't been a manager for very long, they're not as confident in some of these areas, especially dealing with difficult employees and knowing how to go about, trying to motivate one individual to maybe learn a new skill. So in the survey, what came out of it is the number one reason that our clients call upon us or need us to be here, so to speak, is this very issue, is this issue of providing advice, providing training, providing mentoring, and helping them find the right direction to go and helping them steer along the path of handling some of these more difficult just employee and personal interaction issues. So like John said, go ahead, John.
I'm sorry, and I want to add one on this training. One of the most difficult tasks for a manager is the management of discipline, and it really is something we get enormous amounts of phone calls on. What we have practiced over the last several years is what we call a disciplinary conference. And the reason we hold disciplinary conferences is because from a verbal to a written warning, most supervisors are pretty good at being able to identify that. Not as good as we like sometimes, but they're all right there. But when they want to do a suspension, a termination, a reduction, or something that's more significant, up to including termination, what we do by using this kind of a technology, even regardless of whether we're in Alaska where we have our clients all the way to Florida and back, we use the Skype or the technology so that one of our staff is in a meeting with a supervisor and the employee in question. The supervisor presents to this person as a third party the issues that they're facing about this employee, and the employee has the opportunity then to kind of counter what the supervisor is saying. When all this is done, a report is then given back to the supervisor. We have found over the last 3 years, by doing this, we have reduced our risk, our clients' risks, because we've been able to let both parties see each other's opinion and be able to determine an action or a strategy that can mitigate the problem that was going on. Many times when supervisors are doing discipline, they're doing all the talking and they're not doing any listening, and vice versa, the employee. Well, in the case of a disciplinary conference, we find by doing this, they're talking to us and they're both listening to each other's comments. This has become a very healthy environment.
Next slide, please. This goes right into that topic.
Exactly, and that's why I wanted to start there. Just because all of us have EPLI insurance, we have all the different insurances. We do that because we're just good business practice people. But you have auto insurance too, and when you have auto insurance, just because you have auto insurance, you don't go out of your garage, go down the street and drive erratically. That's irresponsible. So that would be the same thing we're speaking about here. Just because you have employment practices liability insurance doesn't mean that your managers should be walking around the surgery center or the area recklessly, either causing circumstances or not alleviating them by getting involved. Human beings by nature do not like conflict. That's a fact. But a good trained supervisor who is not fearful is not scary to the employees. They feel very comfortable around them because they have a level of confidence. This particular trait of a supervisor will reduce the magnitude of the problem as it's demonstrated on the teeter-totter here to the number of problems, and both can shrink in number and in magnitude. So in some 300 and some odd cases we've had in the last couple of years, we have had only one incident that even became a moderate problem. All the others dissipated.
Next slide, please.
when we are going into all these areas, we're talking about how many times have you guys had to sit around with your directors of nursing and so on, and you go, how many OSHA injuries did we have? Have we stopped OSHA injuries? Do we know about our OSHA? Have we reported our OSHA injuries? And I guess for a moment, if you could just think, have you had a hostile work environment claim against you in the last year or 2 years? If you have, for those of you who have, you know full well the amount of time you go into to eliminate the situation, or at the very least lower your risk. Sexual harassment has become an absolute mind-boggling thing. In the last couple of weeks, we have seen an escalation in some of these activities at work, and then fraternization, just hand washing. And one of the most interesting dynamics, we all love our cell phones, but it's amazing the number of cell phones that are bacteria-ridden that enter into the OR. It is unconscionable that that be a practice to be continued. We know why they're there, but they seem to have no real, I mean, we did surgeries prior to cell phones. I think we can do them without the cell phones there. They generally don't have a purpose. Sexual relations at work, I just spoke about. The discipline with the disciplinary conferences. These are kinds of risk management tactics that you could use to help your supervisors. We provide a series of management training classes that are online that all supervisors can go at their leisure to a 30-minute class to cover on several things from interpersonal relations all the way down to conflict management. And they do quite well after a while. The work environment, we want to make sure that it's safe, so we always got to take a look at that. And then lastly, with regards to risk management, don't just blindly accept unemployment. That does cost your bottom line. If you've done things right, where you've given them a verbal, you've given them a written, and let me throw you an idea that you should take home with you, and that is if you suspend someone and they've gotten to the point where they are not, they're a not so good employee, they're becoming troublesome, why not put them on a suspension with pay before terminating them or suspending them without pay? The reason for that is when you take them and suspend them with pay and it gets challenged by a court of law, the hearing officers we've experienced say the employer even went as far as telling you to go home and think about it without lots of bread on your table, and therefore we find in favor of the employer. It's a tack that we've used quite successfully and reduced unemployment costs.
So the environment these days, I think we've all, read the news, we see things, we understand the economy. It really is having an impact. We're just seeing a real spiking of activity in the risk management area, and if you are too, you're not alone. It's an area that's it's around us. It's partly caused by the environment, partly caused by just normal human behavior, but there are ways and mechanisms to deal with it, and that's what we've been talking about here. Next slide, please. So the last of our 5 strategies, which really in many ways might really be the first strategy, is IT systems automation and measurement. And these are, we're going to talk about here, are ways in which you can use an HR system today, cloud-based systems. They can really be a solid foundation for your processes and be one of the key mechanisms for creating efficiencies around all the HR activities and the employer-employee interactions that go on.
When you look at stuff like this, for those who do not yet have a sophisticated HRIS and interface with their timekeeping and their payroll systems, if those don't exist and there isn't a portal, an electronic portal for your employees, they're coming to you to look for their tax forms. They're coming to you to request PTO. They're coming to you to request vacation days. They are taking their productivity time and they're using it to take care of their personal needs, which that's important. But if you're able to give them the technology to be able to do it without having to be looking for those forms. And again, one of the most important aspects of an HRIS system, a solid one, is if it's digitizing them as much as is possible. For example, a simple task, I-9s. If all your I-9s were digitized, placed in electronic files, and your surveyors are coming by and looking for your I-9s, instead of having to go to the 4th floor basement, box X, to look for the I-9s of everyone, you could literally bring them up on screen and print them out and show them the I-9. This has been acceptable in many situations we've experienced already. What if you had the HRIS system have the capability of informing your employees that their nursing license is being expired, and they get an email automatically without anybody doing any work, and it attaches the actual application for renewal. And then it tracks it to make sure that those nursing licenses do not expire and you are found, oh, we need to get Jane or Joe or Phil their license renewed. So a solid technology background pays for itself if you're looking for the right component parts of an HRIS system. It allows them to look for things such as the employee handbook, where the company says, yes, I do pay for tuition, but on these instances, look at how many hundreds and thousands of pages of Xerox copies no longer need to be made. And if we're talking about ways to save money, what if we save 10 to 20,000 pages of documents a year in copying costs? I'm not sure what yours are, but I got to believe that adds up to some serious money. Allowing the employees to file a grievance or a complaint online. The confidentiality of that is immense. Having the ability to do credentialing and everything being done by the cloud, we have those services available to all our clients. Your current service providers should be either working on that or you should be asking them for it. We believe these are essential to helping you with all the other tasks we talked about. And I guess that's when Tom said this may have been the last of the things we talked about, but in many ways it's one of the first things to implement.
Yeah, and as, again, dovetailing with the Affordable Care Act, W-2 reporting as of next year, for next year, the year after, your W-2 is going to have on it the actual benefits expense paid on behalf of the employee by the company. The medical loss ratio, the calculation of full-time equivalent employees with either a 3-month look-back period or a 12-month look-back period or somewhere in between. Where are you going to have the tools in order to do these things so you can manage your businesses appropriately? Again, the requirements on HR systems is growing in response to this Affordable Care Act as well, and you want to make sure that your system has these capabilities. Next slide, please. So we've gone through 5 strategies, and just to kind of cross over where we see strategies such as compensation and benefits and the correct methodologies there to set up your compensation strategy, hiring your A players, mentoring, managing your risks, and installing some automation tools. These cross over into actual results of improved satisfaction in your employee population, improved employee turnover, and that item right there we've seen on a typical $5 million net revenue surgery center and have a $55,000 impact. Improving productivity by 3% can have a $110,000 bottom line impact. Reducing employment practices risks, 50% realization in a reduced realization in terms of actual claims, whether they're unemployment or work comp or employment practices. On average, we've seen a $45,000 opportunity, and reduced costs in terms of your benefit plan, in terms of your efficiency is gained by a good HR system, $40,000. So we've seen that in a typical $5 million surgery center, a realization of about a $250,000 increase in operating income. Next slide, please.
How do we get there? We need to take a look at all the things that Tom was just referring to, and we believe a strong technology training system, all these components together, will reduce your costs by 1 FTE. If a good HR services provider is out there for you, it should reduce your overall cost by that amount. The payroll service you have to do, but if that's tied in together with that, working with your benefits broker and finding whether or not should you go to self-insured, should you go somewhere else. A solid benefits broker is looking down the line for you. These are the kinds of things that you could use in-house, or you can outsource some, of course. Your other 30 vendors that Tom will get into in just a minute as well. But you can go an ASO, a PEO, or staffing company. These are the methods that are currently available to all of you right now today that will lower your cost if implemented correctly.
Yeah, there are approximately 30 vendors that comprise an outsourced HR service or that a business will have to acquire in some form or fashion in order to truly have a complete HR system. The term human resources management it's a little bit like the word healthcare. It means a lot of different things to a lot of different people. To some, HR management means employee benefits. To others, it's recruiting. Others, it's employee communications or training. So you get the idea. It's really a breadth of service, and there are generalists that practice in HR. There are specialists and subspecialists, similar to healthcare. And really, we believe it's a wide breadth of service capabilities needed because there are just too many things happen with people in your organization, and the requirements from the federal government and from our customer service standpoint, everything in between. We need a full set of resources to attack the issue, and that concludes our presentation. But now we'll open it up for any questions that the audience may have.
Well, thank you, John and Tom, for your very informative presentation. We're now going to begin the Q&A portion of the program, and as a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will attempt to answer as many as we can during the remainder of time that we have, and we'll follow up on any questions we don't have the opportunity to address today. I'm just going to start in with the first question we have here. Our benefit premiums went up drastically this year. Do you have any advice on how I can control these costs?
Well, certainly we touched a bit on it earlier. This medical loss ratio is something you need to be very aware of. And if you're working with a broker and an insurance carrier and you're self-insured, or you're just with a fully insured, you should be able to get your loss ratios and see what's going on. If your loss ratios are in excess of 80–90%, the odds are you're going to end up with a fairly sizable increase. If your loss ratio is in excess of 100% and you're wanting to go and move somewhere else, your chances of doing that are going to be a lot less successful because they're going to look at your claims experience and they're going to find that that's troublesome. If your loss experience is in the 60–70%, you have a lot of bargaining chips when it comes time for renewal. So if you've had an excessively high premium adjustment, you need to take a look at your loss ratios, talk to your broker, and if in fact your loss ratios are in 60–70%, I think you need to have a real serious conversation with your broker to find out why that existed. If your loss ratio is much higher, then I think you can understand. So to answer that question, I think the answer for your question is know what your loss ratio is and speak about it with your broker.
This is Tom. I'd just like to, I'm not sure if everybody can see the questions that we're seeing, but I'll just mention one here. It wasn't really a question but a comment, and I'm just putting out there because I think the person wanted it shared, but they actually engaged a PEO this past year and said that they had saved $200,000 per year just on the medical and dental benefit costs. So we are seeing, and I'm pretty, this is not a person that we work with, so this isn't necessarily just MedHQ that can deliver these things. There are many providers out there, and it's certainly an area that engaging a PEO or a staffing company is an opportunity for many people to save a significant amount of money.
If I may, before Kathy, there's a question I just saw here, and this is a very important one. It talks about workplace complaints with regards to medical directors or medical staff. We find that, and I think it's it's something that it goes on. We know that. If your board has a medical committee, we advise our clients to work within the medical committee of the board to help do the policing themselves. Providing training to your staff and your supervisors about it is one thing, but having the board of trustees, who are generally made up of physicians and medical staff, those are the people that then can monitor and patrol that. So I just thought I happened to see that and I wanted to make a statement on it. So I apologize.
Okay, great, thank you. This next question is, what is one commonly overlooked step providers could immediately take towards reducing HR costs?
And that was with relationship to vendors? Could you repeat the question?
What is one commonly overlooked step providers could immediately take towards reducing HR costs?
Well, that's what I want to make sure I heard that. One of the things that is very important, because these providers are coming to you, they better be doing good background checks on their employees. And the reason for that is you are responsible for the safety of the work environment where your employees work. So if, in fact, the background checks aren't done or they're done haphazardly, there are a variety of ways to do solid background checks and some are not so solid. But I would say if that's one that's overlooked, that's definitely one that your vendor should be telling you they're doing this for you.
And I would say if we're talking providers as in, surgery center company itself, one of the things I think we could all, it's a tricky thing for the average person, but that's hiring. Making a mistake in hiring can really, down the road, cost a significant opportunity cost or a significant direct cost in terms of turnover. So just having good hiring practices and interviewing practices, using interview guides that we mentioned during the presentation, and including your peers and your A players in that interview process is really critical.
Thank you. Do you have any tips for installing an effective disciplinary structure?
Well, I think we did cover that a little bit, and just try to remind you, having a solid, progressive, discipline, corrective action system that includes the steps from verbal to written to suspension to demotion to reduction in pay to termination in some order, and not have a 1, 2, 3 strike rule. Most of the companies that we have experienced having a 1, 2, 3 year out have a tendency to have more difficulties with that later than ones that have a little bit of a flexibility that allows for the decision to be made and not to be so rigid. The disciplinary conference we talked about earlier is certainly an attribute we found a great deal of success with. So a third party like this is encouraging.
Okay, thank you. This question by an attendee says, we are a small, less than 50-person business and cannot get a loss ratio until almost November because of the insurance company's restrictions. You mentioned a loss report, but we are unable to get it. Can you comment on that?
Persistence is one of the things that comes to mind. I think calling them and saying, hey, what gives here? I mean, you have a certain amount of ability to put some pressure on them, especially if you happen to be a good customer of theirs. And don't underestimate your broker. If you have a broker, I would think you need to put a great deal of pressure on your broker to help make this happen. If you're a small group and you're self-insured, you certainly have the ability to get your information a lot easier than you are with a larger group. They have a tendency, the Humanas and the Cignas and those of the world, they think it's their data. But you can actually combat that by working with your broker and kind of threatening them with their life, sort of.
Okay, great. Do you utilize the disciplinary action steps in cases of insubordination?
Absolutely. And we do it, I mean, I want to give you an example. Let's give an example of insubordination. I don't do the job. The supervisor may give a verbal reprimand. The next day they don't do the job again, or they just are talking back or whatever. They might end up getting a written reprimand. And things go in compression and frequency and magnitude. The next day, not only being insubordinate, they throw a chair at the supervisor because I'm not doing it. Well, that might be a disciplinary conference. We listen to why they threw the chair, and we may still come back out, and that becomes a suspension. And now we have a trail of things that go on, because when it comes time to terminate them and they go to the unemployment or they go to an attorney and they ask for some assistance on some action against the center, you have a legitimate, progressive, step-by-step method. You tried to change, alter, correct the behavior, and it was unsuccessful.
Okay, great. This next question is, what is the average time spent training an OR nurse? Our OR manager spends weeks and weeks having a preceptor with new hires, which gets very expensive. For instance, 2 RN salaries in each surgery.
With regard to that, I think, go ahead, Tom.
Well, I was going to say, here, I had a couple of thoughts come to mind. One is we can certainly get back to the person on an average time spent. I don't know that we have that at our fingertips, but I'd also mention just a couple of things. Again, back to the hiring process. Every market's different. Some markets, it's a much bigger challenge to find the qualified staff that are going to be able to perform in your surgery centers. And again, and also depending upon your case mix, you know, if you're doing something that's pretty routine, maybe GI or ophthalmology, maybe it's easier. But if you're doing, but even then, it's not always easy to find a good GI nurse or a good, good nurses in the particular specialties that you're operating in. So I think it's a lot of times a local market, employee market issue. And I just want to say that at the outset. On the actual average time spent, I think that's something we can look into and get back to the person on.
Thank you. We have time for one final question. Are there any glaring liabilities providers often miss?
Well, I think the top 2 right now is the hostile work environment. It's almost like everybody's watching CSI and Boston Legal or whatever else that's going on. And the other is sexual harassment. Those 2 right now, I mean, we know about the malpractice insurance and all that, but we're talking about the interactions of staff, because all of your money is wrapped, a lot of your money is wrapped up into your employee cost. The hostile work environment issues that you face today and the sexual harassment are, in fact, very important. They should be paramount in almost all your training sessions. Every time you're having a staff meeting, it's our opinion that you should be covering a topic or an item about interactions, reporting capabilities, reporting responsibilities, not being fearful to bring it to your attention of your supervisor or bypassing them. So I think when you think about 2 of them, top 2 that right now are out there, it would have to be those 2.
Thank you. I want to draw the attention of the attendees to the last slide you see on your screen. If you have any further questions or want to contact MedHQ, the website is up there, www.medhq.net. Telephone number is 708-492-0519. I want to thank John and Tom for their excellent presentation, and for all of you who participated today. We look forward to having you join us again for future webinars. This will conclude today's program, and have a wonderful afternoon.